These casualties have just arrived in MSF's hospital in Hammam al-Alil, south of Mosul. The team in this specialised trauma unit treat patients wounded by bullets, bomb blasts or shrapnel. Most of the wounded are brought to the hospital having been stabilised in medical posts set up by the army near the front line. Opened 6 weeks ago, the hospital has already treated 1,400 patients, half of them women and children.
They usually come in big waves, so on the same day we can receive up to 50 injured, sometimes within 1 hour, and they all come together. They're family units that come together, not just single patients. So it's a really, really intensive project and intensive activity.
As the fighting intensified in February, MSF opened several facilities in the region. Teams are working in hospitals and maternity centres in and around Mosul and are providing primary health and mental health services in clinics set up in several displaced persons camps.
La situation elle est quand même assez urgente parce que si on voit l'opération à l'est de Mossoul, en 3 mois, on a eu environ 1300 blessés et environ 200 000 déplacés qui sont sortis de la ville de Mossoul-Est. Là aujourd'hui à Mossoul-Ouest, en 1 mois, on a les mêmes chiffres qu'en 3 mois à Mossoul-Est.
The situation of the 400,000 people still in western Mosul is particularly alarming.
The areas we have visited in West Mosul, there are huge infrastructural damage. Most of the houses have been destroyed during the offensive, the military offensive. There are food needs. There are no water and sanitation system, as most of it has been destroyed during the war. There is an overall lack of supplies. There are no education system in place, no vaccination, no primary healthcare access, and no obstetric care.
The teams working in the hospital in Kayaha are seeing the consequences of the deterioration in living conditions in Mosul and the hardship in the displaced persons camps and their impact on children's health.
The children coming from Mosul, most of the parents was forced to give the children food that is not appropriate for the age, like yogurt or flour with water or sugar with water for children less than 6 months. They can have a war injury, bomb blasting or other kind of severe injury. It's frequent to find children with the bronchiolitis also in our countries, but here they are a lot because probably the virus are spread very easily in the tent as the tent are overcrowded and the children are very small.
For the hundreds and thousands of people who've been forced to flee, the harsh conditions in the camps only add to the psychological scars left by the war and the uncertainty about their return to a city largely reduced to rubble. Twelve women die of cervical cancer every day in the Philippines. The organisation Likan has tasked Lina with informing the women of Tondo about the importance of getting tested.
We know that cervical cancer is preventable. It's one of the most preventable cancers that anyone can have. And we would like to give women a fighting chance because we know how significant they are as persons and their role in society.
When a test detects precancerous lesions, women in Tondo are given cryotherapy, a quick procedure that involves the freezing of cells. Patients presenting signs of a more advanced stage of cancer are referred to the hospital. And girls aged between 9 and 13 can get vaccinated. 25,000 young girls in Tondo have been immunised. The clinic receives around 80 patients a day. MSF, present in the Philippines since 2016, was able to benefit from the work initiated by Likan, who've been running a programme in Tondo for close to 10 years now.
They're interested in making sure that the farthest reaches of this vulnerable and very marginalized population has non-judgmental access to healthcare in a situation where they wouldn't normally have that access.
The Tondo programme is breaking new ground. MSF wants to demonstrate its viability to incite the Filipino government to support such initiatives, including in challenging settings. Haidan is in North Yemen, an area directly affected by the war that began over 2 years ago. Not far beyond the rubble left by the attack on the hospital 18 months ago is the town school. It too was bombed.
It's a malnourished child, 1 year old, with diarrhea, so gastroenteritis since 1 week.
A health system in a state of total collapse. The soaring cost of essential supplies. The people of Yemen are paying a very high price.
All the civilians that nowadays they don't know where to go because the hospitals are closed for many reasons, because there are no more money to pay the staff. It's difficult to find drugs inside the countries, and the health structure have been affected directly by the war, destroyed by the airstrike.
Since MSF's return, the hospital has an emergency room and maternity and paediatric units again. As a result of the conflict, over half of Yemen's medical facilities are no longer open. It's estimated that close to 15 million of the country's inhabitants are without access to the most basic medical care. The nutrition situation in Nigeria, South Sudan, Somalia and Yemen is extremely worrying. But the figures of 20 million people and $4.4 billion do not suffice to declare a famine. The definition of a famine is very precise, and MSF's experience in the area should help provide some context. There are 5 levels of food insecurity, with famine being the worst. The term famine can be used when the following criteria are met. The mortality rate exceeds 2 deaths per 10,000 people per day, acute malnutrition exceeds 30%, and 1 person in every 5 is not getting enough to eat. According to surveys held in these 4 countries this winter, only 2 counties in South Sudan fulfill these criteria. The others are considered at risk. MSF knows from experience that periods of actual famine are relatively rare. They are limited both in time and space, and are marked by very high mortality, not just among those considered at risk, young children and the elderly, but the whole population. The causes of famine are varied. They can be natural. But in the case of these 4 countries, the food insecurity is largely man-made, with conflicts preventing people from cultivating their land, cutting off supply routes, and pushing up food prices. There are 3 ways to respond to a food crisis. Re-establish access to adequate supplies of nutritious food. This can be achieved either by enabling local people to cultivate their fields, to tend to their livestock and trade, or by distributing food. These require allowing civilians and aid workers to circulate freely. Provide nutritional support to the most vulnerable, particularly children. Timely distributions of food supplements adapted to their specific needs prevent the onset of acute malnutrition. Treat cases of severe acute malnutrition, either in the home with ready-to-use therapeutic foods or in hospital. Medical teams also treat malaria, respiratory infections and diarrhea, illnesses triggered by malnutrition and that increase the likelihood of death. None of these are possible in some areas of Nigeria, South Sudan, Yemen and Somalia, not through lack of funds, but because their inhabitants are isolated and cut off from the world by warring parties who have little concern for their survival, but on whom access to aid depends.
C'est une population qui a vécu des choses très difficiles et qui ne se sent pas encore du tout en sécurité, d'autant qu'il continue à y avoir des bombardements, des militaires partout, des tirs partout. Ils vivent dans la peur, ils vivent dans la crainte des représailles et ne savent pas exactement quoi dire et à qui le dire. L'intérêt de ces consultations, c'est que c'est un endroit qui leur est proposé et dont ils savent s'emparer, ce qui est un bon signe, puisque ça va leur permettre peut-être de se poser, d'être aidés et d'intégrer tout ce qui leur est arrivé pour continuer leur vie dans les meilleures conditions possibles. J'ai rencontré des enfants qui étaient très en difficulté, qui avaient des troubles du comportement et les parents, surtout les mères, puisque les pères n'étaient plus là, les mères étaient encore plus en difficulté parce qu'elles-mêmes n'avaient plus la capacité de faire face aux troubles et aux émotions de leurs enfants. Et il y a des mamans qui ne savaient pas faire autrement qu'attacher leurs enfants pour pouvoir les contenir et éviter que leur débordement puisse gêner les voisins ou les autres membres de la famille. Et ces mamans étaient complètement démunies, alors que ce sont au départ de bonnes mères, elles ne savaient plus comment faire. Donc le travail n'était pas que la prise en charge de l'enfant, mais aussi la prise en charge de la maman et la prise en charge du groupe formé par la maman et par l'enfant, voire par les frères et sœurs.